Oh, okay. So another question was about building supply back up if you lost it. So yes, this is definitely possible. And so in general, if you had a like good supply before and then you stop breastfeeding or decrease for whatever reason, that is usually a really good situation for domperidone, the medication to increase supply. Usually women who had a good supply and then lost it briefly and then start on domperidone again will see a really good increase in their supply, often to what it was before, especially like when you could need to pair the domperidone medication with frequent pumping or nursing. If you didn't have a great supply and then you stop nursing for whatever reason and try to get it back, that can be a bit more difficult. And again, that's kind of, it's nice if I can see you. So I generally spend an hour or sometimes a bit more finding out the problem, kind of assessing both you and baby and stuff. So if you didn't have much of a supply and then you want to bring it back, that would be when we kind of need to look at the bigger picture and figure out why you didn't have much of a supply before. Yeah, hi everyone joining us. So another question was, what about supply in moms who know they'll be having a C-section? So good question. So what you can do, if you know that you're going to be having a section for whatever reason, is antenatally or like before the baby's born, starting at 37 weeks, you can actually express breast milk. And we say 37 weeks because that's when your baby's term, and expressing milk can bring on contractions or even like bring on labor. So you wouldn't want to do it before that. Even at 37 weeks, maybe just clear it with your obstetrician, midwife, family doctor, or whatever. So at 37 weeks, you can start either hand expressing or pumping, either are fine. And you can save, so you'll be getting colostrum. In general, you'll be getting a very tiny amount of it, like sometimes just a few mils, but you can save it. To save it, you would either have to like wash hands or like sterilize pump parts, hand express or pump, usually into just like the tiniest bottle, or if you're hand expressing into like a shot glass or something, because you're just getting such a tiny amount. And then you take like a sterile syringe and suck it up, and then you can freeze that and bring that to the hospital to give to your baby. That being said, that's a lot of work. So don't feel that if you're gonna pump or hand express before baby's born, you need to do all that. Because I find if it's a big thing, you have to like wash out your pump part and stuff, you'll never hand express. And your supply won't actually increase that much before your baby's born. So if you want to keep the colostrum, then that's great, good for you. If you don't, just like hand express in the shower, hand express like every time, like before you're getting changed. Just kind of do it as often as possible. And there are studies that you'll see your milk come in sooner and have more milk when it does come in. So yeah, really good question. Okay, so to everyone joining us, Dr. Emily Sullivan talking about breastfeeding, going over questions that people had from last week, and then just general things that people ask about a lot. So another question from last week was, what about marijuana and breastfeeding? Good question. Getting asked this more recently. So aside from like marijuana in the breast milk, which we'll talk about in a second, same with alcohol, which we'll talk about alcohol again too. I talked about it last time, but lots of questions around that. So same with alcohol. Obviously, the bigger risk is being too impaired to watch your baby. If you're smoking the marijuana, then the secondhand smoke, because that will increase the risk of SIDS or like sudden death in baby. And then not knowing exactly what's all in the marijuana and however you're smoking it. Hopefully that's less of an issue now that it's legalized. Yeah, so, and then marijuana and breast milk. So it is excreted into the breast milk in moderate amounts. And as opposed to alcohol, that the same amount is found in your blood and your breast milk. Actually, 8 times more marijuana is found in the breast milk than in your blood. So more transfers into the breast milk. Not only does it get in the breast milk and affect things that way, it can also, studies have shown that it can decrease supply. So these are just animal studies. Obviously, like, we can't do these in person. Maybe now that it's legalized, we'll be able to do these in people. But so animal studies have shown decreased supply in breast milk because it decreases prolactin that we talked about before, the like pro breastfeeding hormone, and then it might also have some effect on the actual like mammary tissue, breast tissues. And then, so like, obviously there haven't been a ton of studies on marijuana and breastfeeding, because it was illegal just until recently, and it's hard to get ethics and approval around like babies and breastfeeding and drugs, understandably. But so there are some studies. So there are some studies. There's some that show that like if you're smoking marijuana and you breastfeed, your baby might reach developmental milestones later, at 1 year of age. And then just in general, like in the studies in marijuana and developing brains of kids and teens, we think that probably the marijuana in the breast milk will affect the like rapidly developing brain, and then developmental milestones in babies, toddlers, and yeah, we don't really have any long-term data on that, obviously. So hopefully now with legalization, we'll be able to get a bit more information about, just like marijuana and safety and breastfeeding and all that. But definitely at this point, we're advising to abstain, to not use it while breastfeeding, kind of for all the reasons we talked about. Can decrease supply and can affect the baby's brain and development. Good question. So we talked about drinking and breastfeeding last time, but there were more questions about it, and it's a really common topic. So we'll go over that again. So there's definitely a few reasons not to drink and breastfeed. Obviously, because if you're too impaired to care for your baby, that's a big problem. You can, like, if you're too sedated to co-sleep with your baby, that can be dangerous, and you can smother baby as well. And then again, potentially decreasing your supply, especially if you are drinking a lot and you're hungover and dehydrated the next day. But in general, so in contrast to the marijuana, where a lot gets into the breast milk and we're worried about the baby ingesting that, in general, baby ingesting alcohol is not one of the reasons to not breastfeed and drink. So if you have, say, like 1 to 3 drinks, your blood alcohol level is probably at or around 0.08. So we used to, like the drinking and driving laws used to be like, if you're less than 0.08, then you're safe to drive. So yeah, say you have, kind of 1 to 3 drinks, your blood alcohol level is 0.08%. This would mean that the alcohol, so your blood level is 0.08. That would mean your breast milk level is also 0.08. And when we think of, so like wine is like 12%, vodka is 40%. So this would mean your breast milk is 0.08%. And that is what your baby is ingesting, that percent of alcohol. So what is, like, how much is 0.08%? So juice that's sold in stores is actually allowed to have like up to, I think, 0.08, 0.09, 0.1% of alcohol just from like normal fermentation on the shelf. That's a reasonable amount that they've allowed to be in juice. So I'm not saying you should give your baby juice, but most people, if they're say like 6-month-old, had juice or something, you wouldn't be worried about the alcohol content of that juice. So that is the amount that's in your breast milk. Same thing, like kombucha is 0.3%. So like if your child had a bottle of kombucha or something, you wouldn't be worried about them getting drunk, and that's 0.3%, like significantly more than 0.08%. Not only that, but like I definitely do not recommend you do this, but if you like drank so much that you were extremely intoxicated or passing out, even then your blood alcohol level and your breast milk level would only be like 0.1%, 0.1 to 0.2% probably. So your baby is not getting much alcohol in the breast milk at all. So all of that to say, alcohol in moderation, totally fine for baby to drink that milk. Your level of intoxication will be what decides whether you can care for your baby or not, not how much alcohol they're getting in the milk. So yeah, in general, having a drink or two and breastfeeding your baby, totally fine. Yeah. So lots more people have joined us. Not really any other questions. Just kind of going over the questions that we have from last week and then common topics. I'm gonna make sure that I answered everyone's questions from last week, but I think I have. Yes. Okay. So those of you that just recently joined, Dr. Emily Sullivan. I do breastfeeding medicine. I'm a family doctor, but I really love breastfeeding and talking about breastfeeding and seeing patients to help them breastfeed. Oh, got a question. What to do about mother getting a cold sore while breastfeeding? So all you have to worry about is direct contact. So just them having the milk is totally fine, but you just want to make sure that no part of them touches your mouth or the cold sore. But the milk is totally fine. There's no problem with that. Same thing, like if you got shingles, the milk is totally fine. You would just want to make sure, like say you got it on your ribs, that you covered the shingle skin changes completely with a bandage. In general, so that's a really good question, like what to do when you are ill and nursing. Almost always the best thing to do is to keep nursing, because even before you have like full-on illness, you're going to be making antibodies to that, and the baby's going to be getting that in the breast milk, so they are actually far better protected than you are from your illness. So in general, the best thing to do when you're sick is to keep breastfeeding, and try to stay really well hydrated. That's probably the biggest risk to being ill and breastfeeding, because just, yeah, even if you just have a cold, you get dehydrated, but especially if you have like vomiting or diarrhea, going to be really easy to get dehydrated, and then your supply will decrease. So trying as much as you can to staying really well hydrated while you're sick, but totally safe to breastfeed and actually awesome for baby, because then they'll get protection against the cold. And often, like, well, I've definitely seen this in my home, but then with lots of patients, like everyone will get sick in the home, except the baby who's breastfeeding. So yeah, good question. Definitely continue breastfeeding when you're ill. Good question.